Hi everybody. As I promised you, I'm gonna post some videos in my channel about the entrance exam for nursing and also the NCLEX exam. So this video is gonna be a short video because I'm gonna talk about the TEAS, and on a later video it's gonna be about the NCLEX. Okay, so far, just so you know, I'm at the beach right now, and I'm walking by the beach, and I'm taking advantage of that time since I'm just walking, enjoying the beach here. And I'm just gonna talk to you about the entrance exam, since many people have asked me to talk about the TEAS. Okay, so for the TEAS, so for those of you who don't know the TEAS, TEAS stands for, it's T like Tom, E like Edward, A like Apple, S like Sam. So if you search it, it is an exam that students who took their prerequisites for nursing, I think for nursing school, and it works also for other majors such as dental hygiene, radiography, respiratory therapy, therapist program. So all these programs, they do require that entrance exam, which is called TEAS. Okay, so I spoke. As I told you in a prior video, that you should have taken your prerequisites, of course. So prerequisites are the classes that you have to take prior to enrolling into the nursing school. Okay, so just a quick and a brief summary about those classes. So it's biology, English 101, microbiology, general psychology, developmental psychology, anatomy physiology 1, anatomy physiology 2, nutrition and diet therapy, and humanity class. Another class, I forgot the name, but it's like another class. So anyways, about like 10 classes, they're like required to prior to entering the nursing school. So once you finish those classes, make sure you maintain a good GPA, because it is part of the requirements, at least 3.0, at least in my college, the college where I took my nursing program. So make sure you check that with the advisor. And A's, at least a B in those science classes. Just maintain a B, and so that way you can get your GPA for good GPA. And so once you finish those classes, you go ahead and take that exam, the TEAS, which is it has 4 sections. So section 1 should be reading. So they give you a text, either a text or a poem, and then you answer the questions. And then after the section 1, the section 2, which is science. Science mostly is anatomy physiology 1 and anatomy physiology 2. And then of course you have to know about cellular respiration, something that you did in the biology class. So make sure you review that. And section 3 is math, which is very easy. Algebra, pretty much algebra, pre-algebra, if I would say, not even algebra, it's pre-algebra, very easy. And then the last section, which is English language, which is just correcting mistakes in sentences and stuff like that, which is also easy. So those 4 sections that are included in the exam. So it's a one-time, like you take it one time. You cannot just stop it and resume. You may take it on the campus or virtually, so it depends on the options that your college offer. And it is timed, of course, so I think it's 4 hours if I'm not mistaken. And make sure that you manage your time wisely, because you don't want to be behind when answering questions. You don't want to take too long when answering the questions, because you might be behind and then it will shut off. It will shut off at the end of the timing for each section. So make sure you answer them correct. I mean, answer them on time, because otherwise you can lose so many questions without answering them, and that's going to affect your score. Okay, so the minimum score for in my college is 65%. Other colleges might differ, but as long as you pass with 65%, then you're good. As long as you get the minimum score that they require, you're good. So you pass, and then you just apply for the nursing school. The nursing program. So these are the requirements. You cannot apply to the nursing program unless you have the prerequisites, the good GPA that they need, and of course the TEAS, the passing score in your TEAS. That's about it. So that's pretty much about the TEAS. And what I would recommend is to prepare like a month in advance. That's what I did. I took a month to prepare. Pretty much I took like a week for each section. So 1 week for reading, 1 week for math, 1 week for science, and 1 week for English. The book that I use is Mometrix. If you just Google it, Mometrix. So that is, I liked it because it has like all the sections. So it goes over, like, you practice. I did the whole book pretty much. So each section, it goes over like different scenarios, different practice examples, and you go over all the information, all the material. It's just to kind of refresh your memory when it comes to the science, cellular respiration, all the things that we did in biology. You want some refresh on that. And then once you do that, and at the end of the book you have practice exams, that's what I recommend for you to do, to practice these exams. You're just gonna have to pretend like you're in a real exam. You're gonna sit in a quiet room, and you take your 4 hours for that exam, and then you set the timer, and you just take those exams. And if you score well, like above 70%, then you're good. You're ready. You're very prepared for the exam. So there's, I think, at least 4 or 5 exams, practice exams that you can do, or you can take, and that will definitely, determine your preparedness for that exam. Okay. Of course, on YouTube, there's a lot of resources that you can use. Also, there's other books that you can use. So it's up to you, but just don't overwhelm yourself with so many resources. Just stick to one, and then if you take it and you take your time in preparing it, you should be good. Okay. So that's pretty much about the entrance exam, and I'll talk to you later about another exam that you take, which is at the end of your nursing program. So it's crazy. Well, actually, before that NCLEX, before that exam, you need to take the HESI, which is the exit exam. So you see how many exams you got? You got the entrance exam, then you get the HESI, which is the exit exam. After each semester of nursing school, you take the HESI exam, and then after you graduate and you finish your program, then you take the board state exam. So that's the NCLEX. That's what it's called, the NCLEX. So I'll talk to you about that on another video, and I hope you learned so much about the TEAS. So many people reached out to me to explain what the exam is about. So I hope that clarifies your confusions about that test. And then on the next video, I'll talk about the HESI, and in another video, I'll talk about the NCLEX. So that way you have them. That way you have a good and clear idea about all these exams, because I know it's very, very confusing. All right. Well, thank you so much for watching, and of course, if you if you need more information about what has to do with nursing, just feel free to subscribe and share that video to anyone who might be interested. And I'm gonna try to post videos, as many videos as I can, of course. And I'll see you next time. All right.